When a pandemic hits the news cycle, the stories are usually high on drama, but there's also another side, the effects of lost contacts, earnings, and structure, even the beginning of a strange new school year. That's disruptive enough for adults, but for children, it can be more reasons for concern about trauma. To offer some guidance and let us know about an upcoming virtual discussion is our guest from mental health treatment provider, Franciscan Children's in Brighton. We'd like to welcome its Director of Behavioral Health Services, Dr. Fatima Watt. Thank you very much for being with us, Fatima.
Hello, thanks for having me. I'm so happy to be here today.
Doctor, I want to start with, I guess, the reasons why the most normal, healthy people in the world right now might be feeling depressed or anxious. I mean, you've got the illness going around, you got people who are losing jobs, the rent's coming due, they don't have money. So what's the difference between being anxious about something like that and being traumatized?
Yeah, absolutely. It's all about how the person responds to the event, and our past history has a lot to do with that. And so if you're a person who has had trauma in the past, who doesn't have a lot of social supports, it's likely that the pandemic has proven to be much more stressful and can prove certainly to the sense that it's traumatic. And that trauma feeling comes from feeling a heightened level of anxiety all the time, and feeling a level of panic that doesn't seem to resolve. And feeling that level of anxiety all the time certainly has an impact on our brains, on our bodies. It can make you feel sad. It can make you feel worn out. But I don't want people to over pathologize how they're feeling, because this being in a pandemic is not normal and it's new for us. And so feeling those ups and downs, the highs and the lows, feeling almost a level of burnout is all normative, considering that we're in a very abnormal time. I would say the difference between being truly traumatized and just having a normal response to a very abnormal situation is really the ability to get through your day. Are you able to do the activities that you enjoy within reason? Are you reaching out to friends and family? Are you able to get through your activities of daily living, getting in the shower, dressing yourself? And are you able to experience moments of joy and happiness? And if those things are not true, then I would feel more concerned and recommend maybe reaching out to someone for mental health support.
I can also imagine a parent who might be at home with a child more than they normally would be, seeing things and feeling that doesn't look right. When does that mean trauma?
Absolutely. I think parents are the most keen observers of their children. And if your child's behavior seems off, and you're not able to kind of break the cycle for them, meaning they're more tearful and your hugs and cuddles don't seem to be helping, their bedtime routines are disruptive, and even with your support, you're not able to find them a level of calm so that they can settle down for bed at night. If they're not able to engage in play, whatever that means for their age. So for a younger kid, we want to see them engaging in imaginative play and being up and moving around. For teenagers, we want to see them socializing, reaching out to peers, maybe listening to music, writing, poetry. If your child's not able to engage in those things, and their routines are disrupted and they're not able to find comfort and peace from your efforts, I would say that's more signs of being traumatized than just experiencing anxiety during the pandemic.
It's interesting, some of the activities you mentioned, because they amount to really talking about the pandemic, sometimes in a playful way, and sometimes in a way that actually expresses fears. How does that help?
Yeah, I think it's so important to be talking about it, because our kids' imaginations are far worse than the reality. And so when kids misperceive things, when they don't understand a situation, they're likely to make up the details to fill in the gaps. And a lot more times their imagination is much worse than the reality. And so by talking to your children, you can control the narrative. You can also see what things they're understanding, what things they may not be understanding, so you can provide that factual information for them. And as humans, we all feel more comfortable when we're armed with information. That's also true for children.
What about the return to school for children because they might not be the highest risk group in terms of being vulnerable to infections. But on the other hand, going back to school in a different way right now, why could that possibly be traumatic for at least some children?
Absolutely. So for some children, school is stressful at baseline, whether they have a hard time with learning, whether they have a hard time socializing. School should be a wonderful place for all kids, but sometimes school in and of itself is stressful. And because there's a lot of unknowns, that creates a lot of anxiety. At this point, most parents know whether their schools are going to be remote or hybrid, but the details of what that's going to look like is still very much ambiguous. And when we're dealing with ambiguous situations, that can certainly heighten anxiety. And so I think for parents, the most important thing is to tell your children what you do know in a very concrete way that's appropriate for their developmental level. And it's okay to say, I don't know, but here's how we're going to figure it out. I think depending on whether the child has known someone who has gotten sick or if there's a vulnerable family member might also increase anxiety about their risk of making their friend sick or making a family member sick. So I also think it's important to talk to kids about what are the things that are in their control, whether they're going to school remotely or whether they're going to school in person. So if they are going to school in person, washing hands, wearing a mask, how to keep distance, what to say and what to do if someone gets closer than you're comfortable with. All of those things are within a child's ability to do. And when they have more control, that can decrease the anxiety.
One thing that must be going through some people's heads right now is the sense that if you have a really, really good insurance policy, you can get access to outpatient treatment for mental health issues. But if you don't, short of going to a hospital emergency room, people are going to be saying to themselves, I think I have nowhere to go about this. Or is that necessarily the case?
Yeah, that is absolutely not the case. There are service providers out there. There are some providers who accept a broad range of insurance. At Franciscans, we accept a broad range of insurance, including Mass Health. There are other providers who will offer a very low sliding scale fee. And so I would encourage people to reach out to providers, reach out to their insurance company directly because support is available and no one should have to suffer during this time.
Well, one of the other things that you're doing at Franciscans to help people get through this is you're going to be having a virtual community conversation. Can you explain how people can get access to that and what you're going to be talking about?
Yes, so we are going to be talking about COVID and our kids, post-traumatic stress disorder, and the return to school. And that is going to be tomorrow at 8 p.m. And registration is required, but the video will be posted on our website afterwards. And so if individuals are not able to register to join tomorrow night, they can check us out on YouTube, and the video will be posted there afterwards.
One other thing that crossed my mind too is that if people look for help with what at first looks like a mental health issue, and even if they go to a community health center, for example, they might end up getting help with other things, maybe food insecurity or a housing problem. So
Absolutely.
isn't that another reason for people to be reaching out?
Absolutely. One of the most stressful parts of this pandemic is the fear over not having basic needs met. And with schools closing early, that food insecurity really became a true issue for many families. And so community health centers, hospitals can help connect you to resources in the community to make sure that your basic needs are met. If basic needs are not met, it's really difficult to worry about mental health and all of these other things. And so I encourage people to definitely reach out, especially if they need resources.
I don't want to alarm people unduly, but there have been catastrophic events in the past that were traumatic. I'm thinking maybe of something like Hurricane Katrina. They were short term at one level, but in terms of trauma, that could be a very long term problem, couldn't it?
Absolutely. And so, how people cope during the pandemic, their access to resources, all sort of mitigate the long-term response. And so I have a sense that for many, once the pandemic is over, they will return to their normal levels of functioning. But there will be some that have long-term consequences that may need support in the months or years to come after the pandemic is over. And that's okay. There are supports available for that.
Well, finally, one more reminder about how to get in touch with that virtual conversation or ask questions to Franciscans. Is there a way people can do those?
Yes, absolutely. You can check out our website, franciscanchildrens.org, and there's a behavioral health page. If you want to submit questions, or if you want to get in touch with a behavioral health clinician, you can reach out to us through our website. You can also check us out on our social media, Twitter, Facebook, and our YouTube page. And you should be able to find all the resources that you need.
Thank you very much for taking the time to join us.
Thank you so much for having me.
Yes.
Be well.
Yes, you too. Dr. Fatima Watt from Franciscan Children's.